Hello everyone, welcome to another installment of Baby Whoop channel. I'm your host Alicia. On today's video, we will talk about birth control and fertility. We will briefly discuss the existing type of birth control and then move on to how they could affect your fertility. By the time you and your partner are ready to start a family, chances are you may already have spent 5, 10, even 20 years of your life trying to make sure you didn't get pregnant. So when the time comes for you to finally turn all that effort around, it's only natural to wonder what effect all those years of birth control have had on your body and how long it will take you to become fertile again. Keep in mind that there's no single answer to this question. The amount of time it takes for a woman to regain her fertility after stopping birth control varies for each woman and depends on the birth control methods she is using. What's more, you'll find there's an awful lot of misinformation out there. Scan the internet or even ask medical professionals, and you're bound to get contradictory responses about how various methods of contraceptive affect your fertility. For starters, it is important to recognize that women who have been pregnant before have an advantage. That is, we know that they can conceive. Many young women will start a birth control method without knowing if they are fertile or not. For starters, it is important to recognize that women who have been pregnant before have an advantage. That is, we know that they can conceive. Many young women will start birth control method without knowing if they are fertile or not. Some examples will be teens who prescribe birth control pills for very irregular periods, or women given hormonal birth control to control the symptoms of endometriosis. In both these examples, the woman may have underlying medical conditions which can decrease fertility. Another important component is the age of the woman when she decides to conceive. If you are 25 when you begin using birth control and you are 35 now, your chances of getting pregnant in the first year of trying will have gone down. Your ability to get pregnant gradually decreases as you age, starting at age 25. Poor health and irregular period may also decrease your fertility. After you stop any form of birth control, you may have a more difficult time getting pregnant, simply because you are older than when you started using birth control. Let's now take a look at some of the methods for preventing conception, as well as the amount of time needed to regain fertility. The first method is the barrier method. Barrier methods include the diaphragm, cervical cap, Leah shield, male condom, female condom, and spermicidal foam, sponge, gel, suppository, and film. If you relied on condoms, a diaphragm, etc., your return to fertility is as simple as leaving them in your night table drawer, as barrier methods only work while they are on the body or in the body. As an added bonus, condom can actually help your fertility by protecting you against sexually transmitted disease or STDs, such as chlamydia, gonorrhea, which can lead to infertility. The next type of birth control method is the combination hormonal methods. These methods include pills, skin patches, and rings. They contain both estrogen and progestin. You can get pregnant right away after stopping regular dose or low dose hormonal birth control. About half of women get pregnant in the first 3 months after stopping the pill, and most women get pregnant within 12 months after stopping the pill. Specifically regarding the birth control pills, it works by preventing ovulation. Once you stop taking the pill, the hormones are out of your body quickly, usually within a couple of days. So if you are now ovulating normally, that means your body is back to its normal rhythm. Next is the progestin-only hormonal method. These methods include pills, implants, and the shot, such as Depo-Provera. With the implant, you can get pregnant as soon as it is removed. It may take 3 to 18 months after your last shot to get pregnant. The progestin-only pill, also called the mini pill, does not seem to delay fertility. Most women will get pregnant within 6 months after stopping the mini pill. And lastly, we have the intrauterine device or IUDs. For both the copper IUDs and hormonal IUDs, fertility usually returns with the first menstrual cycle following IUD removal. Whichever birth control method you've relied on, The important thing to remember is that once you go off of it, you must be prepared for pregnancy. Thanks for joining me on our continued discussion on pregnancy and beyond. For a more in-depth explanation on how birth control affects fertility, you can visit babywoop.com. This is Alicia signing off. Please leave a comment, rate my video, and don't forget to hit that subscribe button. Bye now!